So long COVID, or also recently described as post-acute sequelae of SARS-CoV-2 infection. This is a term suggested by US researchers, in particular by Professor Fauci, is a new condition which describe the persisting and chronic symptoms that some patients with COVID-19 develop after acute disease. This is still a not well characterized conditions because it is mainly characterized by symptoms that some periods can be present, some periods can be less pronounced. And main symptoms are extreme fatigue, post-exercise fatigue, headache, chest pain, dyspnea, rashes, hair loss. In women, changes in periods. It's really myalgia, arthralgias. It's a really varied conditions, very difficult to be very well characterized. This has been widely described, I would say almost worldwide in adults, after a very early report which was published the last summer by Italian colleagues working with adults in my same institutions, which clearly documented that a high number of patients with acute COVID-19 had still persisting symptoms months after being discharged. And these symptoms seems to be present not only in those who had a severe acute disease, which was maybe more expected, but also in those who had a mild or moderate disease. Later, during the pandemic, as a pediatricians, we asked ourselves if this condition was also affecting children. And last summer, we implemented with a group of international researchers a survey which was developed by the ITW study group, which is an Oxford research team, very well known and established in international research settings. And with this survey, we documented initially in a cohort of Italian children, but this was later also documented in a cohort of children from UK, Sweden, and Russia also, that children as well were reporting a similar pattern of persisting symptoms as adults are doing. These symptoms are very similar, like headache, fatigue, extreme post-exercise malaise, myalgia, arthralgias, a very similar clinical picture. Some has tachycardia or chest pain. Although in children, these reports are still a bit isolated and we don't know yet the full estimates. According to our experience here in Italy, from our first study, we found that about 10 to 20% of children were having some of these persisting symptoms. We now are doing analysis on a larger cohorts compared to the previous study. But I have to say that, since these are symptoms of children only assessed in my institutions, the full numbers can be a bit biased because in my center, I developed an outpatient unit to control post-COVID children. And so, since the family pediatricians are aware of this service, I cannot exclude that the number I see of long COVID children is a bit higher compared to other centers. In fact, to be honest, I have to say that a recent large and apparently proper study from UK found that about 4% of children are reporting some symptoms. Since I also have to say that these symptoms are very vague, and also adults patients struggle to be noticed by healthcare professionals. So it's very difficult to find real estimates of this long COVID syndrome because symptoms are vague. It also depends on how you check patients, how you communicate with families, how you involve them in partnerships. But in any case, more or less frequent, it is a fact or matter that several researchers independently and in different countries are reporting that a number of children which were well before COVID-19 are having these symptoms after acute disease. The most frequent pattern I am seeing in my post-COVID unit, which is an outpatient unit, although sometimes I had to admit a few patients, is extreme fatigue headache, and the most characteristic finding is the easy fatigability after exercise. Most of these children who had a normal life before COVID-19 are having and also were used to play footballs or maybe other extrascholastic activities, are struggling to go back to a full normal life as the preclinical COVID. I repeat, we don't know yet the full numbers. Most probably the rates are much lower to those reported in adult patients. But this does not mean that we have to underestimate the long COVID in children. We have to understand this properly. We do not reduce this as normal psychological issues related to the pandemic restrictions, because there is increasing evidence that some immunologic inflammatory ongoing or can somehow trigger these conditions. Therefore, we need to study it properly, because patients and families deserve our responses, and also because a better understanding of this condition can help to gain a better knowledge of post-infectious diseases conditions, which are very frequently. This is not only happening with COVID, but it also happens with other diseases. So this should also be seen as an opportunity to raise knowledge from other infectious diseases. About the adults, I know that most major centers nowadays worldwide have established dedicated post-COVID units. And this is much easier to understand because the clinical impact of acute disease has been massive in adults. So it was quite obvious and automatic, spontaneous for institutions and researchers to set up these post-COVID units in adults. And I would say that every major city and major hospital regarding adults have them. With children, the situation is a bit difficult. I'm not aware of, I know of many researchers starting some research in this topic, but I'm not aware of many outpatient settings around. In our patients, we probably are among the first centers that established a dedicated day for post-COVID children. But we are not alone, and I know that during the last weeks, more and more countries are starting to recognizing that this issue matters children as well. And so I know that some other centers here in Europe are working to find funds to support these centers. In the US also. In low to middle income countries, I expect that this will be much more difficult to set up, because this follows several radiological features. This means lots of funds to be needed for human resources. So to allow this multidisciplinary approach. About guidelines, with a number of international researchers, with the UK, Russia, and Spain, we are starting to establish local guidelines but these guidelines are mainly focused on how to assess these children. Because, in general, with pediatric practice, we arrive a bit later than adults. And so even in adults, we don't know yet how properly treat these patients. So with children, it's even more difficult. So I would say that no, we do not have yet guidelines on pharmaceutical or non-pharmaceutical management of these children. So we still need a lot of work to do in this area, and this is currently managed on a case-by-case situation. So the trend about serology is better established in adults compared than children. We have some studies that seem to suggest that that children that had COVID-19 seems to have a much higher percentage of IgG positivity. So it seems that the false negative serology is less frequent in children. But anyway, so I will not focus on this point, but I will focus on the point that having a control group is extremely difficult in the field of long COVID, because obviously children have also other conditions, and we know that this is not only COVID that can bring some symptoms like headache or whatever. So it's very difficult to find a control group of children that experience nothing, no exposure to the virus, no other conditions or whatever. So as I said, having a control group is difficult, but this I would not focus too much on a control group, because on a scientific research point of view, the control group is useful. But on a clinical practice point of view, we see these children that had COVID and then these lasting symptoms. Some of them, which I'm also seeing, likely are maybe a minority of children, but some have symptoms struggling since months, not weeks. And so, control group or not, as a physician, as a pediatrician, is my priority to try to understand what happens and try to support these families. I don't know why. While in adults the long COVID is quite well established, also the World Health Organization clearly recognized the existence of this disease. In children, there is still this major narrative on the possibility that this can all be psychological, due to social decisions or whatever. But we see, I'm a clinician before than a researcher. We routinely see children with psychological or psychiatric issues. In my practice, in my experience, the long COVID children are quite different from those with psychiatric issues. They, most of the time, have normal family backgrounds, have no previous issues before COVID-19, do not come to the pediatric emergency department for self-harms or suicide attempts or any acute psychological issues. Also, their families try to properly use their health resources, not to go too much to the emergency department, while usually with the psychological issues, we see quite often these children in the emergency department. So the clinical presentation somehow looks different to me. And also, what is interesting, that we will, have a real pandemic of patients with COVID-19 worldwide having the same symptoms. This is quite strange. So I repeat, I'm not supportive of this narrative. I am trying to assess. We had to admit a few patients who were really struggling. And also from adults, we learned that some traditional diagnostic tools may not be very effective to recognize some organ damage. We recently submitted a case report of a girl, a 14 years old girl, which is struggling with long COVID since October, where she was diagnosed with mild COVID-19. And we found that she had persisting immunological specific characteristics, some pro-inflammatory cytokines going on. And we also found some perfusion defects on lung perfusion CT scan. So, which were not evident on the classic contrast enhanced CT scan. So this means that this long COVID can also be an opportunity to better characterize a full range of conditions, of chronic conditions, which we never gave a name. In general, medicine is more used to deal with acute diseases, because somehow are easier to recognize and to match with chronic conditions. Medicine historically struggles because maybe we do not have yet all the resources to characterize at 360 degrees these patients. This is an opportunity for COVID. We have more found, so we can better understand immunological conditions, autoimmune antibodies, pro-inflammations going on, viral reservoirs, which some authors suggested for COVID-19, or new imaging studies that can detect not only morphological abnormalities, but also functional abnormalities. So I want to be clear, I don't want to overestimate the long COVID. I don't want to say to parents, you have to be scared about long COVID. No, children clearly had a much lower impact from the pandemic, at least from the virus itself. The indirect consequences is another stuff, but so these long COVID issues should not drive some narratives like school closure or whatever, because school opening is very important for children. But I really want to be cautious or not over nor underestimate the disease. We need to treat patients, and even in the remote scenario, we arrive to the conclusion that long COVID is something psychological. But in any case, we need research to do that. And even in case it will be something psychological, these families still need support to improve the daily life of their children. Although, I repeat, I'm more on the organic immune pathobiology compared than just a psychological condition. The possibility of having vaccines for children as well is a great opportunity, and it is another great success of the modern medicine. So it's a really effective tool, at least from first studies available. We know that these vaccines are 100% effective and available. And although children were less impacted by the pandemic, obviously they can, particularly the adolescents, have more severe disease. Also, the adolescents seems to be those who with a higher probability of developing long COVID. So in general, I will say that having the opportunity to immunize children is a very great opportunity. So I'm happy with the vaccinations. I'm happy to vaccinate my children as soon as I can. I expect, of course, that an effective vaccine would have effect also on long COVID, because if children don't get COVID, I see no reason to have long COVID as well. So I would say, on a biological point of view, that I expect these results, and we will continue anyway our long COVID surveillance even after children will be immunized, in order to have data to demonstrate this hypothesis. What I want to say anyway about vaccines, since you asked me what I think about vaccines in children, I am extremely happy to vaccinate in children, but we have to say that currently there is a real unethical inequality in vaccine access worldwide, which is unacceptable on any point of view, on health point of view, ethical, moral point of view, because current unequal distribution will really slow the resolution of the pandemic on a global scale, because it makes no sense to have 100% immunization, let's say in Italy, but having an uncontrolled pandemic in at least half of the world. So I think that, I repeat again, vaccinate children is a great success, but prioritize children versus compared to adults more at risk in low to middle income countries is again another piece on the inequality and inequality in current medicine and health programs. So I repeat, super happy about this opportunity, but will be a real huge paradox if we vaccinate 100 million children in the US and Europe, and we will have 100 million of adults not vaccinated in India or in Africa or in Latin America. But these are different topics. On a biological point of view, happy for children. Not sure this is ethical to prioritize them toward countries.